At any one point in this conflict, how many people are pregnant? It must be about what happens when they're displaced and what happens to them and to their pregnancies. They estimate 25-30% of women are pregnant. And then at any time, what sort of care do they have access to? Women who are attacked. What happens to their family structure? What happens in their communities? What violence? What happens to them physically? And just couldn't sort of stop thinking about it. I just wanted to figure out a way to help or contribute in some way to the work that was being done. The hospital had various forms and various ways of keeping records, but starting in about 2004, 2005, the records became more consistent and the data collection became more consistent. And the forms that we looked at are psychosocial intake forms. And when a woman comes to Pansy Hospital to seek care for herself after enduring sexual violence, she meets with a social worker who does the intake form. Some of it includes quantitative data, the woman married, demographics, widowed or abandoned, how many children, how old was she, level of education. And then there's more data about the incident itself. What was the date of the incident? How many assailants were involved? What time of day did this occur? Where did this happen? And then following that information is a narrative, and that is written down in the words of the woman who's being interviewed. And then there is a psychosocial assessment, and so an assessment of the level of trauma that the woman has experienced. So there were 1,021 charts from 2006. For the past few months I've been analyzing the data and understanding more of the relationships between where did the attacks occur and what characteristics make certain women more vulnerable. And a lot of information has come from the study, which has been useful for directing programs and policy. We came back with the intention to analyze 2005, 2007, and 2008. And so we met with 3 Congolese residents who have experience with data entry and are currently training them to enter in the data. We looked at the charts for 2005 today and counted them, and there were approximately 1,200 charts just from 2005. So I'm suspecting it will be about the same for each year, so about 30, probably 3,600. Those are the women that came to Pansy. And what about the women that can't reach Pansy? Have they sought care somewhere else? Are they still at home, too ashamed or too almost too upset to be able to come in to seek care? We're only seeing the ones that have the means to be able to get to Pansy Hospital.